Checking into the hospital for a surgical, diagnostic procedure may not provide an accurate assessment of satisfaction leading up to the potential pathology and hence makes these results difficult to interpret. Discussion of morbidity findings. Both cross-sectional and prospective studies of PA and illness virtually unanimously support an association between higher PA and health. The more critical, in regard to the hypothesis that PA is the causal factor, prospective morbidity studies found benefits of trait PA in conditions as diverse as stroke, rehospitalization for coronary problems, the common cold, and accidents. 3 of these studies either controlled for NA or assessed NA variables and found no influence on outcomes. Cohen et al., 2003, Oster et al., 2001, A. M. Smith et al., 1997, 1. Middleton and Bird, 1996, used a measure that confounded PA and NA. Additional work with replications within disease, repeated use of the same measurement techniques, and control for the potential role of NA would strengthen this literature considerably. Even with these caveats, the near unanimity Unanimity of results supporting a beneficial association of PA and morbidity is impressive. Survival. Survival studies are prospective studies of groups of people with serious, often fatal, illnesses. They are basically mortality studies of people who are sick. PA, usually state, is assessed at the onset of the study, patients already diagnosed with the illness, and participants are followed for some defined period of time. Either patients are selected for a specific stage of disease, or severity of disease at baseline is controlled for in the analysis. At the end of the study, the investigators identify who is still living. There are relatively few of these studies, and they are mixed in terms of PAs predicting survival. Table 3 summarizes the PA and survival studies. A study by Moskowitz, 2003, used the 4 PA items from the CSD to predict survival in patients with AIDS, ages 25 to 53. Data over approximately 7.5 years revealed that PA, and not NA, was associated with an increased likelihood of survival, RR. 0.86 when control variables, e.g. baseline markers of illness. Progression and medication were accounted for. Another study examined survival in 356 individuals 10 years after coronary angioplasty, Van Domburg, Peterson, Van den Brand, and Erdmann, 2001. The researchers used the Heart Patient Psychological Questionnaire, Erdmann, 1982. The questionnaire included a 12-item subscale assessing a well-being component, e.g., I feel happy, and other subscales measuring inhibition, despondency, and disability. The well-being score was related to lower mortality prior to adjustment, 2.5, p.02. However, this finding did not withstand controlling for baseline measures of medical history and health. Several studies examined whether PA is associated with survival in a variety of patients with cancer. Only one found a beneficial effective state, current, PA. In this study, S. M. Levy, Lee, Bagley, and Littman, 1988, examined predictors of survival time in a 3.5-year follow-up of patients with first recurrent breast cancer. They assessed PA at baseline with the Derogatis, 1975, Effects Balance Scale. The scale consists of 4 positive, joy, contentment, affection, vigor, and 4 negative, anxiety, guilt, depression, depression, hostility. 5-item subscales. Apart from medical assessments, e.g., longer disease-free interval, physician's prognosis, fewer metastatic sites, baseline joy was the only predictor of longer survival. Survival hazards model with biological variables. 0.46. 3.01. Negative mood was associated with shorter survival. However, it was not as potent as PA and did not enter the most powerful statistical model. Another study examined survival time in patients with advanced malignant disease, e.g., unresectable pancreatic cancer, gastric cancer, lung cancer, colorectal cancer, glioma, with a median. Expected survival time of 1 year. Casselleth, Lusk, Miller, Brown. And Miller, 1985. In this case, none of a number of psychological and social measures, including general life satisfaction, assessed by 8 questions, were associated with survival. The remaining 2 cancer studies found evidence for negative effects of PA. Derogatis, Abeloff, and Meliseratos, 1979, contrasted patients with metastatic breast cancer who survived less than 1 year, short-term survivors, to those who survived a year or longer, long-term survivors. The Derogatis Affect Balance Scale, see earlier description, was administered at baseline to assess current mood. Long-term survivors had a lower effect balance, indicating a mood balance that was shifted toward higher NA and lower, but not significantly so, PA. A final cancer study examined happiness and survival time in a group of patients with early-stage melanoma. J. E. Brown, Udo, Koljak, Coates, and Dunn, 2000. They also found that shorter survival duration was associated with elevated baseline levels of general positive mood as assessed by a 1 to 100 millimeters line scale anchored by my mood is miserable at one end and happy at the other. Another study indicating negative effects of PA on survival examined happiness as a predictor of 4-year survival in patients with end-stage renal disease. Devens et al., 1990. Happiness was assessed by the Atkinson, 1978, Life Happiness Rating Scale, a bidirectional index ranging from very unhappy, 1, to very happy, 11, with 5 indicating an even mixture of unhappiness and happiness. When all factors were entered in a forward stepwise fashion, happiness was the only psychosocial factor to step in immediately after organ dysfunction ratings and age, revealing that higher levels of life happiness were related to shorter survival times. Upon closer examination, the researchers noted that 95 of the 97 participants indicated happiness levels of 5 or above, an even mixture. This suggests that longer survival was associated with even mixtures of happiness and sadness, more neutral moods, whereas mortality was associated with high levels of only happiness. Finally, several studies have examined the predictive value of QL in survival in a manner that at least separates mental health, including effect, from physical health, although most of these mental health subscales confound NA. And social and cognitive factors with PA, survival after open heart surgery was benefited by the energy, pep, and vigor component of PA, Chakran et al., 2000, but not by a summary mental health score that collapsed across energy, positive, negative emotions, and social functioning, Rumsfeld et al., 1999. Another heart disease study examined them. Positive Effect and Health 933. This document is copyrighted by the American Psychological Association or one of its allied publishers. This article is intended solely for the personal use of the individual user and is not to be disseminated broadly. Table 3 Summary of Positive Effect, PA, and Survival Findings Study Participants Follow-up PA Measure. State, trait, was PA associated with survival? Could NA play a role in this association? J. E. Brown et al., 2000. 426 patients with early melanoma, mean age 57. 5 years general mood from miserable to happy, on 1 to 100 millimeters line scale. State, shorter survival, yes. Bimodal PA, NA scale. Casselleth et al., 1985. 204 patients with a inoperable cancer. Mean age 60.3. 5 years life satisfaction. Trait. No effect now. Chakran et al. 2000. 215 patients receiving open heart surgery. Mean age 65. 3 years energy section of the Nottingham Health Profile Questionnaire. Trait. Hunt et al. 1980. Energy was associated with better survival, yes. Low energy could be NA. Derogatis et al. 1979. 35 patients with breast cancer, 3 years. Derogatis affects balance scale. State. Shorter for those with lower affects balance scores. High NA and low PA. More NA is associated with longer survival. Devins et al. 1990. 97 patients with renal disease, ages 16 to 79. 4 years life happiness from very unhappy to very happy. Trait. Shorter survival if too happy, yes. Bimodal PA. NA scale. Kalantarzada et al. 2001. 65 outpatients receiving chronic dialysis. Mean age 54.5. 1 year SF 36. Where et al. 1993. Mental health subcomponent. Happy, calm. Discussion of survival findings. There's too little consistency across the few existing survival studies to draw any conclusions. However, there is a pattern of results suggesting a hypothesis. It appears that those with end-stage disease, Derogatis et al. 1979, Devins et al. 1990, and diseases with high short-term mortality rates, patients with melanoma, J. E. Brown et al. 2000, were harmed by high levels of PA, whereas those with diseases or disease stages with longer-term expectations for living, where adherence to medical regimens and other behavioral factors, e.g., exercise, better sleep, could play a role, were benefited by PA. S. M. Levy et al. 1988, Moskowitz, 2000. 2003, or unaffected, Van Domberg et al. 2001. The QL literature, though difficult to interpret because of the multifacet measures, showed similar effects. Wearing QL was not beneficial for patients with end-stage renal disease. Kalantarzada et al. 2001. Parkerson and Gutman, 2000. Nor for those recovering from serious surgery. Rumsfeld et al. 1999. There is, however, some sense time that mental vigor and pep may help in some fashion, e.g., Chakran et al. 2000, Constrom et al. 1996. It is possible that high levels of PA in populations with serious illness are harmful. They are associated with underreporting of symptoms and hence could result in inaccurate tracking of disease progression and consequent incorrect disease treatment. Similarly, patients high in PA may be over-optimistic and consequently not follow their treatment regimens or take their illness seriously. It may be that reporting excessively high levels of PA when calm. Fronting a life-threatening disease is a sign of maladaptive coping. Inappropriate illness behavior, denial, or even emotional suppression, whereas reporting an even balance of emotions is an indication of facing the reality of the situation, taking their illness seriously, and not suppressing felt emotions. Emotions, Or it may be that persons with serious illness who are high in PA are more likely to choose to live the remainder of their lives without suffering the pain and invasiveness of indicated treatment regimens. It is also possible that in studies of serious and end-stage diseases, the absolute level of PA or the balance between PA and NA may be more important than simply having more PA. Recall that in one study, the majority of patients reported a relatively even balance of NA and PA, and that it was the patients who were out of balance, i.e., reporting very high levels of PA relative to NA, who had the lowest survival rates. Devins et al., 1990. In another study, Derogatis et al., 1979, patients with breast cancer who had longer survival did not have absolute low levels of PA. They simply had lower levels than those who lived for under 1 year. Finally, it may be that in those cases in which PA was neither beneficial nor harmful, some patients are too far along in their illness progression for effect to play an important role. For exam PLE, if tumor cells are already in the millions and replicating at a high rate, or the kidney has already failed, it is difficult to imagine how emotions could play a strong role at this point in the disease process. Markers of disease severity and physical functioning. A number of studies examined associations between PA and markers of physiological functioning in ill or older populations. These include both experimental and naturalistic prospective IES. Table 4 summarizes the PA and severity function studies. The majority of these studies examined the effects of changes in mood on pulmonary function in individuals with asthma. Asthma, in general, NA and stress are associated with reductions in pulmonary function, reviewed in Wright, Rodriguez, and Cohen, 1998. Although less attention has been paid to PA in the laboratory, induced PA has been generally found to reduce pulmonary function as well. This suggests a volosnon-specific response in the airway. However, studies conducted in natural settings suggest that state PA is associated with improved pulmonary function. In a laboratory study of adults with mild and moderate asthma, Ritz, Steptoe, DeWild, and Costa, 2000, found that both positive, happy, content, elation, and negative, anxiety, anger, depression. Mood-inducing movie excerpts resulted in poorer pulmonary function, respiratory resistance, measured by forced oscillation, as compared with neutral movie clips. Although the decreases in pulmonary function seen in this study were not clinically significant, they do indicate that strong positive emotional arousal in individuals with asthma may place them at risk. Of interest, this research group has also found evidence of the same changes in pulmonary function with PA and NA in participants who did not have asthma. However, the health implications of this are likely negligible. Ritz, George, and Dom, 2000. Ritz, Steptoe, et al., 2000. In another study of adults with asthma, mean age 27, Ritz, Clausen, and Dom, 2001, manipulated mood with happy pictures and self-referent Belton statements, e.g., "I'm pleased that most people are so friendly to me," as well as similar depressive stimuli. In this case, pulmonary function was also generally worse. After both happy and depressed mood inductions, however, there were only significant decreases in function with depressive stimuli. Florin, Freudenberg, and Hollander, 1985, similarly examined physiological reactions to positive and negative emotional stimuli in 7.5 to 12-year-old children with bronchial asthma and in healthy matched controls. Each child was exposed to a pleasant, funny film and a stress-inducing task. Similar to the studies described earlier, pulmonary function, assessed as forced expiratory volume, FEV, decreased under both experimental conditions. The healthy controls showed no changes in forced expiration in response to these manipulations. In a study of children with moderate to severe asthma, ages 8 to 17, positive emotion induction did not influence levels of pulmonary function, but did change variability of response. Miller and Positive Effect and Health 935. This document is copyrighted by the American Psychological Association or one of its allied publishers. This article is intended solely for the personal use of the individual user and is not to be disseminated broadly. Table 4. Summary of positive effect, PA, and its associations with disease severity and physical function in prospective and experimental studies. Study participants follow-up/study time. PA measure, state, trait, outcome. Was PA associated with health markers? Could any play a role in this association? Affleck et al. 2000. 48 individuals with moderate, severe asthma, mean age 42.1, 21 days, ambulatory. Items from circumplex, e.g., peppy, happy, calm, state, PF. Yes, higher PF for peppy and active. Yes, assessed with bipolar mood vector. After et al. 1997, 21 individuals with moderate, severe asthma, mean age 43.4, 21 days, ambulatory. Naturalistic mood report, state, PF. Yes, higher PF, no. Castleth et al. 1985. 155 patients with stage 1 to 2 breast cancer, mean age 52.2. 5 years. Life satisfaction, trait, recurrence. No effect. No effect. Florin et al. 1985. 36 control versus individuals with asthma, ages 7.5 to 12, post-induction test. Mood induction with comedic film, state, facial expression in response to movie assessed. Forced expiratory volume, no. NA was associated with reduced expiratory volume. Gabay et al. 1996. 63 patients with coronary artery disease, mean age 62.6. 24 to 48 hours, ambulatory, happiness, state. Silent ischemia, no effect. Anger was associated with increased likelihood of ischemia. Golette et al. 1997. 132 patients with coronary artery disease, mean age 59. 48 hours, ambulatory, happiness, state. Silent ischemia, no effect. NA was associated with increased likelihood of ischemia. Houghton et al. 2002. 20 patients with irritable bowel syndrome, ages 17 to 64. Post-induction test. Hypnosis-induced happiness and relaxation, state. Balloon distension pain. Relaxation decreased pain, whereas happiness had marginal benefit, no. Highland, 1990. 10 individuals with mild, moderate asthma, ages 19 to 59. 15 days, ambulatory. Panis, current mood, state, PF. PA was associated with higher peak flow in 3 participants, others null, no. Wood, 1997, examined how induction of happiness, sadness, and a mixture of those emotions with different segments of the movie ED, the extraterrestrial, influenced oxygen saturation in the blood and autonomic function. Oxygen saturation is an indirect measure of pulmonary function and was used in this study instead of respiratory resistance because researchers did not want to interrupt the flow of the movie. The happy scene resulted in less variability in oxygen saturation than the sad and happy, sad mix scenes. However, it was not different from the neutral scene, film credits, in terms of its oxygen saturation, nor were total levels of oxygen significantly different between all scenes. These findings indicate that happiness may be associated with greater stability in oxygen levels in individuals, but not overall levels. It is, however, important to note that the scene used to invoke happiness also involved a great deal of relief. Boy discovers that ED is not. Actually dead, which may be different in terms of arousal and valence than a pure happiness manipulation. Naturalistic studies of PA and lung function tell a somewhat different story. In a prospective study, Apter et al., 1997, Moni toward pulmonary function, peak expiratory flow rate, PF, and mood items based on the circumflex model, 3 times daily over a 21-day period in 21 adults with moderate to severe asthma. Participants rated 20 mood adjectives according to their presence in the past 30 minutes. 0, not at all. 6, very much, including pleasant mood, happy, cheerful, unpleasant mood, sad, blue, active mood, active, lively, and passive mood, quiet, passive, as well as combinations for each category of active, passive, and pleasant, unpleasant, e.g., passive, pleasant calm, active, unpleasant anxious. Pleasant mood was the only mood variable associated with PF at the next time point, lagged analyses. Specifically, more pleasant mood predicted better pulmonary function. There are also several concurrent, same-day, analyses of AM. Ambulatory studies of mood and pulmonary function in individuals with asthma, see Table 4. Highland, 1990, monitored mood and PF in 10 adults with asthma for 15 days. He reported that 3 of the 10 participants with asthma showed increases in PF on days with more positive moods, and another 3 showed a trend in the same direction. In another 21-day study, Affleck et al. 2000 also found increases in PF with increased arousal and pleasant arousal, PEP, and also showed that positive valence is associated with fewer asthmatic symptoms, even when PF levels are controlled. A divergent outcome arose out of a 24-day study of 7 male adults with mild asthma by Steptoe and Holmes, 1985. They found that PF was correlated with mood across days in 6 of the 7 Participant PANSS, but that the directionality varied among them, i.e., 3 showed higher PF with negative states, 2 showed higher PF with PO-essitive states, and 1 showed decreased PF with negative. In a 21-day study of adults with mild to moderate asthma rates, and Steptoe 2000 found that there was a decrease in pulmonary function as assessed by FEV on the occasions that participants reported their most extreme levels of positive and negative moods. They also found that these effects may be attributable to high levels of self-reported arousal, low calm, during those extreme moods. Interestingly, they found that P-elicited pulmonary function in the laboratory and P-associated function in a field study were not correlated. This questions the extent to which the Labo. Table 4, Rotary model is representative of real-world response. Continued. Study. Participants. Follow-up/study type. PA measure, state, trait. Outcome. Was PA associated with health markers? Could NA play a role in this association? Steptoe and Holmes, 1985. 7 individuals with asthma, ages 18 to 25. Ambulatory over 20 days. Ambulatory with 3 visual analog scales: calm, angry, relaxed, tense, elated, depressed, state. A final study found evidence for mirth-triggered asthma, Gay-Rard, 1978. A survey of children with mild to severe asthma revealed that approximately 34% of the children had experienced asthma as a result of a gleeful stimulus. The author also had children with asthma record asthmatic symptoms and PF over 30 days. Results showed that mirthful events, e.g., funny movies, were often associated with triggering asthmatic symptoms and resulted in a decrease of PF to approximately 65% of baseline levels. Overall, in the laboratory studies of individuals with asthma, acute states of arousal, whether associated with PA or NA, appear to be the key component associated with worsening of pulmonary outcomes. In contrast, naturalistic studies typically, but not always, have found that state PA was associated with improved pulmonary function. This discrepancy suggests that the laboratory paradigm may not be a good model of what happens in the real world. This may be because many of the laboratory manipulations induced more intense and arousing emotions than most day-to-day fluctuations assessed in the naturalistic studies. In fact, when analysis of naturalistic mood focused only on more extreme levels of PA, the results were consistent with those of most laboratory studies. Gerard, 1978, Ritz and Steptoe, 2000. As noted in the survival section, the association between state PA and some outcomes may be curvilinear, with small to moderate changes and improving outcomes, but truly intense emotions having detrimental effects associated with arousal. It is also possible that differences in results from the laboratory and field are attributable to different methods of assessing pulmonary function. Because peak flow measurements taken in the field are inaccurate if participants do not blow into the peak flow meter as hard as they can, it is possible that effect might influence the outcome through its impact on adherence to the measurement regimen. See Affleck et al., 2003. For example, those low in PA not trying as hard as those with higher PA. Irritable bowel syndrome, IBS. One study examined how colonic motility, a measure of pressure in the colon, is influenced by hypnotic induction of excitement, anger, and happiness in 18 adult patients, Orwell, Houghton, Taylor, and Maxton, 1992. Hypnosis on its own resulted in decreased colonic motility, likely because of the relaxation, sometimes considered an unactivated positive state, naturally induced by hypnosis. Excitement, activate pleasant mood, on the other hand, was associated with increased colonic motility relative to the controlled hypnotized state, but not the same degree of increase as was observed in anger. Induction. By contrast, happiness was associated with decreased colonic motility as compared with the pre-hypnotic state, but it was not significantly different from the neutral, relaxed hypnotic state. In sum, whereas general relaxation had benefits for motility in the bowel, excitement resulted in worsened motility, and happiness had no effect. Because IBS inflammation and occurrence is strongly associated with the occurrence of stress and NA, see Searle and Bennett, 2001. For a review, it makes sense that relaxation would show benefits. Ischemia in patients with coronary artery disease. Two STUD-IS monitored patients with coronary artery disease for 24 to 48 hours and examined whether ambulatory mood changes were associated with silent ischemia, Gabay et al., 1996, Galette et al., 1997. A heart attack, myocardial infarction, occurs when the heart muscle is deprived of oxygen, resulting in the death of heart tissue. Silent. Ischemia is an inadequate supply of blood flow and oxygen available to heart tissue without any chest pain. Silent ischemia is a way of looking at oxygen deprivation that occurs much more often than heart attacks and may provide a model for determining emotional and other triggers relevant to coronary artery disease. In both cases, positive emotions were not related to the occurrence of ischemia, but negative emotions such as anger, anxiety, and frustration were associated with its future occurrence. Physical function. A small group of studies examined the associations between PA and decreases in functional status in older individuals and function and recovery in those with disease. Two cross-sectional studies found that lower life satisfaction is associated with an increased likelihood of requiring nursing home care and being more frail. Finlayson, 2002, Strawbridge, Shima, Balfour, Higby, and Kaplan, 1998. On the other hand, a third Reddit. Sun and Felton, 1989, found that happiness was not associated with changes in self-reported physical limitations, disability in a group of patients with rheumatoid arthritis, RA. However, NA was. A prospective study of a 65 to 99-year-old Mexican-American cohort we described in the mortality section, Oster et al., 2000. Also examined whether baseline effect was associated with functional status and mobility over a 2-year follow-up. The authors found that low levels of PA at baseline were associated with decreased walking speed in a time-date feat, approximately 2.4 n, walking test, as well as a decrease in the ability to engage in daily living activities, e.g., bathing, feeding oneself. The influence of NA in this case was not reported. In sum, this is a very small and varied literature, and it is not possible to draw any conclusions. However, there is a suggestion that outcomes subject to motivation or self-report bias, e.g., function and self-reported limitations and disabilities, were susceptible to positive PA influences. Discussion of PA and disease severity and physical functioning. There are several very different outcomes represented here, and other than the asthma work, not enough evidence exists in any single area to draw any sweeping conclusions. Overall, the data suggests the possibility that associations between PA and outcomes vary with the extremity of the effective response, probably through effects on arousal level. The most extreme effect was most likely to have a detrimental effect. It is also consistent with the possibility that PA is associated with improvement on outcomes that are subject to motivation or self-report bias. Self-reported health outcomes. Physical symptoms. The reporting of physical symptoms partly reflects underlying disease, but such reports are also influenced by psychological states and traits of patients. Cohen and Williamson, 1991. Mechanic, 1977. Pennybaker, 1983. Individual ALS with high state and trait NA report more symptoms than one would expect from their underlying disease. Cohen et al., 1995. Watson and Pennybaker, 1989. And individuals high in trait PA report fewer and less severe symptoms when objective markers of disease are held constant. Cohen et al., 2003. Higher trait levels of PA and SWB have been associated with fewer symptoms and better self-reported health among patients with Lyme disease L. 938 Pressman and Cohen. This document is copyrighted by the American Psychological Association, or one of its allied publishers. This article is intended solely for the personal use of the individual user and is not to be disseminated broadly. Kins et al., 1999. Lupus. Grutzkolten et al., 1988. Multiple sclerosis. Gatton, Brookings, and Bolton, 1993. Coronary artery disease. Sullivan, LaCroix, Russo, and Walker, 2001. Upper respiratory infection. Cohen et al., 2003. Takush, Reguera, and Gestelotero, 2001. Older individuals. Brissett, Leventhal, and Leventhal, 2003. Edwards and Clemack, 1973. Palmore and Lewicard, 1972. Spritzer and Snyder, 1974. As well as among hospital inpatients and outpatients for a variety of illnesses, e.g., de Gucht, Fischler, and Heiser, 2004, Kval and Patodia, 2000, Schneider et al., 2003. In general, those with mild illnesses, i.e., allergic disorder, are not less happy or more dissatisfied, trait, than healthy individuals, Roizam et al., 2003. There is also evidence for an association of trait PA and perceived health and symptom reporting in healthy populations. A meta-analysis on subjective well-being and self-reported health found an average correlation between happiness and health of 0.32. Oken, Stock, Herring, and Witter, 1984. More recent cross-sectional analyses have similarly reported better perceived health and fewer symptoms in those with high trait PA. Roizam et al., 2003. Takush et al., 2001. However, Watson and Pennybaker, 1989, found little association between trait PA and symptom reporting, i.e., 1 of 6 samples showed a negative association between PA and symptoms. State PA has also typically been associated with the report of fewer symptoms in healthy individuals. Benjamini, Eidler, Leventhal, and Leventhal, 2000. Kasten, Lawton, Winter, Clevin and Sando, 1997. Watson, 1988a. Experimental evidence suggests that inducing state PA in both healthy Kroll and Uretsky, 1987, Solovey and Birnbaum, 1989, and mildly ill, Solovey and Birnbaum, 1989. Individuals results in more favorable self-evaluations of health as compared with those induced to feel NA and versus a neutral control condition in them. Solovey and Birnbaum study. Finally, prospective evidence also reveals that PA measures predict better self-reported health and fewer symptoms prospectively in older individuals for both state and trait PA. State, Benyamini et al., 2000. Trait, Hertz and Forbes, 1993. And those with upper respiratory infections for trait PA, Cohen et al., 2003. Although these data are provocative, many of these studies also found NA to be associated with greater symptom reporting and poorer self-reported health, begging the question of which component is responsible for the found effects. However, there is some evidence that PA effects on self-reported health are independent of and stronger than those of NA. Benyamini et al., 2000. Cohen et al., 2003. Pettit, Klein, Jankos, and Joyner, 2001. Pain. There is a large literature on the impact of NA on reports of pain. C. Riley, 1999, for a review, but a relatively smaller one on PA effects. Pain, like symptoms, is a perception of a bodily state that is subject to effect-elicited self-report biases, e.g. Penn. Nebaker, 1982, Solovey and Birnbaum, 1989. Not surprisingly, in populations with disease, self-reported pain has frequently been correlated with lower levels of state and trait PA. For example, trait-like measures of PA have been associated with less pain in patients with cancer. Guadagnoli and Moore, 1989, fibromyalgia, Potter, Zatra, and Reich, 2000. Zatra, Johnson, and Davis in Press, and in patients with RA, Potter et al., 2000, Zatra et al. In Press, as well as in hospital inpatients, Kval and Patodia, 2000. State PA has similarly been associated with less pain in patients with cancer, Guadagnoli and Moore, 1989, and in patients with sickle cell disease, Gill et al., 2003, 2004, as well as in healthy populations, Kasten et al., 1997. This cross-sectional evidence, however, may be attributable to the experience of pain-changing perceptions of PA. Supportive evidence for PA's influencing pain is found in experimental studies, see Table 5. PA induced by a wide array of strategies, e.g. imagery, film, audio tape, verbal statements, MEM-ORI recreation, resulted in less reported pain sensitivity and more pain tolerance. See the list of studies in Table 5, with the exception of a study that found no effect of positive imagery on pain threshold, Scott and Barber, 1977. Other support comes from a prospective study showing that PA report among patients with RA and fibromyalgia was associated with less pain report over the following week, Zatra et al. In Press. The majority of these studies also reported that NA is associated with decreased pain tolerance. However, in some cases, it was associated with analgesic effects similar to those of PA, e.g. Zillman, DeWeed, King-Jablonski, and Jenczewski, 1996. L. Though a good number of the experimental studies did not use manipulation checks, the consistency of the relation across multi-PLE studies is impressive. Again, because pain is a perception, evidence linking PA to the report of less pain might be partly or wholly attributable to psychological as opposed to physiological changes. In fact, a common explanation for the PA pain association is that the effect acts as a distractor, e.g. McCall and Mulat, 1984. Although, as we discuss later, PA may be associated with the release of endogenous opioids, providing a potential physiological mechanisms for analgesia. Discussion of PA and self-reported health. In sum, there is considerable evidence linking PA to reports of fewer symptoms, less pain, and better health. These outcomes have practical importance, but there is reason to think that this association may be driven primarily by PA influences on how people perceive their bodies rather than by effect-elicited changes in physiological processes. Cohen and Williamson, 1991. Mechanic, 1977. Pennybaker, 1982. Physiological systems associated with health. Cardiovascular function. Increases in cardiovascular activity support increased physical output by bringing oxygen and nutrients to tissues and carrying waste products away. Temporary increases in BP and HR are a natural and normal response to current demands and expectancies and function to support BFIers that are typically associated with specific emotions, for example, fight and flight. However, recurrent or prolonged activation of the cardiovascular system can result in levels of response that have the potential of influencing health outcomes. Krantz et al., 1981. For example, they may put persons at risk for stroke and coronary heart disease, e.g., Blaskovich and Katkin, 1993, and alter, usually suppress, immune functions such as the efficient division of white blood cells in response to an infectious challenge. Rabin, Cohen, Ganguly, Lysol, and Koenig, 1989. Consequently, PA could contribute to health to the extent it is associated with changes in basal levels of cardiovascular response. In addition, changes in state PA and associated acute changes in cardiovascular response could also be important for those with chronic underlying diseases where short-term emotions may trigger an event, such as an asthma or heart attack. In general, lower within norms. Positive Effect and Health 939. This document is copyrighted by the American Psychological Association or one of its allied publishers. This article is intended solely for the personal use of the individual user and is not to be disseminated broadly. Table 5. Summary of experimental and prospective studies of positive effect, PA, and pain study participants' PA measurement. Induction, state, trait, manipulation checks, control sessions, pain type relevant findings. Adams and McGuire, 1986. 20 older individuals in a long-term facility with chronic pain humorous movie. State, no. Non-humorous movie self-reported pain humorous film was associated with decreased pain report and decreased pain medication. Alden et al., 2001. 50 undergraduates pleasant imagery. State, yes. No imagery condition cold pressor positive imagery was associated with lower pain ratings and longer tolerance. Avia and Camphor, 1980. 79 female undergraduates pleasant imagery. State, no. Control session cold pressor PA was associated with increased pain tolerance. Brule et al., 1993. 80 male students, mean age 20. Positive emotion induction. State, no. 2 control sessions finger pressor PA was associated with lower pain reports. Chavez and Barber, 1974. 120 female undergraduates pleasant imagery. State, no. No imagery condition finger pressor positive imagery was associated with less self-reported pain. Klum et al., 1982. 119 undergraduates pleasant imagery. State, no. No treatment control pressure-induced discomfort. Arm cuff. Pleasant imagery was associated with reduced pain report. Kogan et al., 1987. Experiment 1. 40 undergraduates laughter or relaxation-inducing audio narrative. State, no. Dull narrative or no tape pressure-induced discomfort. Arm cuff. Higher discomfort threshold was associated with laughter and relaxation conditions. Kogan et al., 1987. Experiment 2. 20 female undergraduates laughter-inducing narrative or interesting or uninteresting narrative audio tape. State, no. Control session, no intervention. Pressure-induced discomfort, arm cuff. Laughter-inducing condition was associated with increased discomfort thresholds. Gill et al., 2003, 37 young adults with sickle cell disease, ages 13 to 17, ambulatory, up to 6 months. State, self-reported pain-positive mood was associated with lower same-day pain, but not subsequent-day pain. Pain was associated with lower subsequent positive mood next day. Gill et al., 2004, 41 adults with sickle cell disease ambulatory, 91 days, state. Self-reported pain-positive mood was associated with lower same and subsequent day pain. Hurdle and Hekmat, 1994, 30 undergraduates pleasant imagery, state. No imagery condition cold pressor positive imagery was associated with increased pain tolerance from pre to post-vest. Horan and Finally, there are a number of ambulatory and pain-manipulating laboratory experimental studies that assessed HR variability, HRV, in order to examine the contribution of parasympathetic, the arousal dampening system, activation to PA-elicited change in cardiovascular response. In general, evidence suggests that PIT may be associated with the control of parasympathetic activation. However, the direction of the PA influence on cardiovascular response varied across studies, with some finding activation of this arousal dampening system. Bacon et al., 2004, Christie and Friedman, 2004, McCready, Atkinson, Rain, and Watkins, 1996, McCready, Atkinson, Tiller, Rain, and Watkins, 1995, McCready, Barrios, Choplin, Rosman, Atkinson, and Watkins, 1998, and others decreases in arousal dampening effects, vagal withdrawal, Catapovic Veselica et al., 1999, Fraser, Strauss, and Steinhauer, 2004. Vagal withdrawal may be a function of mood activation because it occurred with joy and gregariousness, but not trust and acceptance in the Catapovic Veselica et al. Study, and with a happy movie induction in undergraduates in the Fraser et al. Study. A single study of undergraduate students, Christie and Friedman, 2004, found no effect of induced PA on HRV. It may be that PA is associated with deeper and slower breathing, i.e., lower respiratory rate and greater respiratory volume, both of which can directly increase HRV. Overall, it appears that arousal plays a key role in the association between state PA and cardiovascular function. Highly activated positive emotions in both experimental, HR and BP, and correlatinal studies, BP only, were associated with increases in cardiovascular response. These increases, however, were typically of a smaller magnitude than those of activated negative emotions such as anger. Sadness and other less activated emotions were, however, less differentiated from PA, see Table 6. Furthermore, the EPI. Denke suggests that PA may be associated with the activation and withdrawal of the system that dampens sympathetic nervous system SNS response, the parasympathetic nervous system, PNS, endocrine Endocrine function. A well-known conduit that could influence a spectrum of diseases is the emotionally provoked release of pituitary and adrenal hormones. As with cardiovascular function, these hormones rise and fall in response to daily challenges, but can constitute a potential risk for disease when they are elevated for a prolonged period or when their diurnal rhythms are disrupted by emotional fluctuations. Hormone dysregulation can influence many physiological systems, including the alteration of both immune and cardiovascular function. Numerous studies have suggested that hormones such as AP, norepinephrine, norepinephrine, ACTH, cortisol, growth hormone, and prolactin are responsive to chemokines. These factors can all drive quantitative and qualitative changes in immune and cardiovascular function and may, in turn, play a role in health outcomes. Table 7 summarizes the studies relating PA to endocrine function. Most of the studies listed in the table have examined the influ. Of mood induction or ambulatory mood evaluations on acute changes in cortisol levels, both salivary and plasma. Cortisol is a hypothalamic pituitary, adrenocortical hormone that regulates metabolic and immune processes. Sheridan, Dawes, Brown, and Zwilling, 1994, that are that are potentially important in autoimmune disease, infectious diseases, diabetes, wound recovery, and some cancers. In general, one might expect cortisol levels to be lower with increased PA. However, cortisol is highly responsive to stress and arousal, e.g., Kirschbaum and Hellhammer, 1989. Therefore, in cases of very aroused PA, e.g., excitement, we might expect increases in this hormone. Laboratory studies in which PA was induced have typically found a decrease or no change in cortisol. For example, Hubert and de Jong Meyer, 1990-1991, have found that inducing joy or suspense via film induction was associated with decreases in cortisol. Others have reported that inducing happiness was associated with decreased cortisol levels, whereas inducing NA increased cortisol. Burke et al., 1989. Black and Friedman, 1968, Buchanan, Al-Absi, and Lavello, 1999, Codispoti et al., 2003, Zachary et al., 1991. Similarly, a study using repeated laboratory inductions showed that a technique that promoted positive emotinal states resulted in decreased cortisol levels 1 month later, McCready et al., 1998. Another study found that watching a comedic performance resulted in decreased cortisol levels in PA. Times with RA, but not in healthy controls. Yoshino, Fujimori, and Koda, 1996. Other studies found no effect of happiness inductine on cortisol response in healthy individuals, even though anxiety and fear inductions increased cortisol levels. Burke et al., 1989. Black and Friedman, 1968. Buchanan et al., 1999, Codispoti et al., 2003, Zacharieh et al., 1991. A single study found no effect of either PA or NA, induced by music, on cortisol levels, Clark, Iverson, and Goodwin, 2001. However, in this case, the last sample was only 10 minutes after the end of induction, which is not enough time to mount a peak cortisol response. A 20 to 30-minute period is typically necessary. All of these studies used more passive inductions, such as watching humorous films, listening to music, or looking at pictures, which may account for the cortisol decrease. Four of the experimental studies found that PA was associated with increased cortisol. Specifically, inducing happiness resulted in the same increase in cortisol as inducing guilt or sadness in students and members of the college community. Huckelbridge et al., 2000. Inducing elation resulted in the same increase as induct ing sadness in female actresses and students. W. A. Brown, Sirota, Nyora, and Engebretsen. 1993. Inducing either euphoric or relaxed happiness in actors resulted in the same elevated levels as inducing agitated or anhedonic depression. Butterman et al., 1994. And inducing amusement resulted in an increase in cortisol as compared with a neutral stimulus. Stimulus, Hubert, Muller, and De Jong Meyer, 1993. Three of these four had participants draw on personal experiences and memories to induce the mood as one component of the manipulation. W. A. Brown et al., 1993. Butterman et al., 1994. Huckelbridge et al., 2000, and two used actors as participants. W. A. Brown et al., 1993. Butterman et al., 1994. Use of these more self-relevant and engaging manipulations may elicit increased levels of arousal not found in the more passive manipulations discussed earlier. Studies of cortisol levels in the natural environment support an association between trait PA and lower cortisol levels, although there is mixed evidence in regard to an association with state PA. Here, we included studies with reasonable sample sizes, 20 or more. Studies of normal populations collecting multiple measures over days or weeks generally found that higher trait. Cohen et al., 2003, Polk, Cohen, Doyle, Schoner, and Kirschbaum, 2005, and state. PA, Kugler and Calvert, 1987, Polk et al., 2005, were associated with lower levels of cortisol. However, 3 studies found no associations between state PA and cortisol response. Riff, Singer. Positive Effect and Health 949. This document is copyrighted by the American Psychological Association, or one of its allied publishers. This article is intended solely for the personal use of the individual user and is not to be disseminated broadly. Table 7. Summary of positive effect, PA, and endocrine function study participants. Design and independent PA measures, state, trait. Manipulation checks, control sessions. Dependent measures. Relevant findings. Burke et al., 1989, 10 healthy men, mean age 27. Mood manipulation, humorous video, state. No manipulation check, control session. Plasma cord, ACTH, beta endorphin, AP, norepinephrine, dopamine catabolite, DOPAC, prolactin. And Dienberg-Love, 2004, Stepansky et al., 1997, Van Eck, Berghoff, Nicholson, and Sullen, 1996. Of the studies looking at endocrine parameters other than psoartisol, several naturalistic studies examined AP and norepinephrine, other stress, hormones that act to increase blood flow and cardiovascular activity. Both high state, Burke et al., 1989, Codispoti et al., 2003, and trait PA, Cohen et al., 2003, were associated with lower levels of AP and norepinephrine. 2 studies found no association between state PA and AP nor norepinephrine. Riff et al., 2004, Stepansky et al., 1997. These are the same studies that found no association with cortisol. Finally, One experimental study found higher norepinephrine levels when happiness was induced, Zachariae et al., 1991, as compared with levels when depression and anger were induced. Similarly, an amusement-inducing funny movie increased AP and norepinephrine significantly, as did aggression, and anxiety-provoking movies. However, the anxiety increases were the most marked. Levi, 1965. In contrast, a study of patients with RA and controls watching a performance of comedic Japanese storytelling, Rakugo, found no impact on AP or NEPI in controls post-performance. However, there was no manipulation check, making the emotional state of these participants unclear. Yoshino et al., 1996. Dopac, a precursor to the catecholamine dopamine, and therefore a precursor to AP and norepinephrine, also decreases with the inductine of PA, Burke et al., 1989, whereas ACTH, which stimulates the adrenal cortex to produce cortisol, showed no increase with PA induction, Burke et al., 1989, Codispoti et al., 2003. Finally, PA is also associated with increases in prolactin, Codispoti et al., 2003, and growth hormone, Burke et al., 1989, W. A. Brown et al., 1993. Increases in both of these hormones are thought to be conducive to better health. In summary, PA manipulations in laboratory studies may vary in terms of their effects on endocrine response based on the specific mood being manipulated and on the extent to which the manipulation. Latione itself engages the participant or requires active behavioral response. In contrast, field studies are generally, put sporadically, supportive of both trait and state PA associations with more quiescent and sometimes lower levels of stress hormones and higher levels of other hormones whose rises are thought to play a positive role in health. Immunologic function. PA may get under the skin to influence immunity by the aforementioned hormones and their ability to bind to white blood cell receptors and have regulatory effects on distribution and function. Ader, Felton, and Cohen, 2001. Rabin et al., 1989. It may also act directly on immunity via sympathetic fibers that descend from the brain to the primary and secondary lymphoid tissues, e.g., thymus and lymph nodes. The fibers release a variety of substances that can influence immune response by binding to receptors on white blood cells as well. Ader et al. Al, 2001. Rabin, 1999. There have been a number of experimental and correlational studies examining the associations between immune function and PA. See Table 8. Secretory immunoglobulin A, SGA, a type of antibody and the main immunological defense of mucosal surfaces, is frequently assessed in psychological studies because it can be measured non-invasively in saliva with little discomfort to the participant. All 9 of the studies assessing total antibodies to all antigens, SGA in response to a positive mood induction, e.g., movies, music, self-reference statements, showed increases. Dillon, Minchoff, and Baker, 1985, Huckelbridge et al., 2000, Labat, Alleman, Walliver, and Martin, 1990, Lambert and Lambert, 1995, Lefcourt, Davidson Katz, and Keenman, 1990, McClelland and Sheriff, 1997, McCready et al., 1996, News, Nitschke, and Bryant, 1996, Pereira, Sabin, Nelson, and Lowe, 1998. Of the 2 studies that induced both PA and NA, both found that SGA increased regardless of valence. Huckelbridge et al., 2000, News et al., 1996. Plasma IgA has also been shown to increase with positive mood induction, as have the levels of two other types of plasma antibodies, IgG and IgM, Burke, Felton, Tan, Bittman, and Westengard, 2001. Of particular note are two ambulatory studies that examined the association between daily PA and the immune system's ability to produce SIgA antibody to a specific immune stimulant, rabbit albumin, administered repeatedly by pill on each day of the study. In both studies, PA was related to higher levels of them. Production of specific antibody to the stimulant, Stone, Cox, Valdemar-Stoddard, Jandorf, and Neal, 1987, Stone et al., 1994. A single ambulatory study of total SIgA found no association between PA and SGA-P. Evans, Bristow, Huckelbridge, Clow, and Walters, 1993. There is a small literature on PA and cellular immune response. PA is clearly associated with alteration in cellular response, but the relationship does not appear to be a simple one. Inducing acute PA increases the numbers of different peripheral white blood cell populations, Burke et al., 2001, Futterman et al., 1994, Futterman, Kemeny, Shapiro, Polonsky, and Fahy, 1992, Logan et al., 1998, Valdemar-Stoddard and Bovjerg, 1997. However, there are acceptions where no differences were found with PA induction, Knapp et al., 1992, Logan et al., 1998. These increases in cell populations are the same as found in response to laboratory stress and are thought to be driven primarily by elevated SNS activation, Herbert and Cohen, 1993b, Segerstrom and Miller, 2004. The effect of inducing PA on a measure of cellular immune function response of cells to stimulation has received little attention. One study reported that induced PA increased proliferation to the mitogen phytohemagglutinin, Piche, Futterman et al., 1994, whereas Auth-Ayres reported mixed evidence, one of two concentrations. For a small decrease in Piche elicited response with acute PA, Knapp et al., 1992. Cytokines are chemical messengers that different cells of the immune system use to communicate with one another. In most cases, increases or decreases in production of specific cytokines are difficult to interpret in regard to health implications because it is regulation, release of the appropriate amount of cytokine given a specific demand. That is of greatest importance for an efficient immune response. Some evidence suggests that PA mood induction increases some cytokines, specifically interleukin, IL-2 and IL-3, and decreases tumor necrosis factor alpha, Midwatch Jaffe, Shalit, Srendi, and Yehuda, 1995. Another study found that after participants watched a comedic performance, IL-6 decreased in. Patients with RA and interferon gamma decreased in both RA and control participants. IL-6 is a sensitive marker of inflammatory processes in the body, and higher levels are usually considered to be a sign of underlying disease processes. Therefore, a decrease in patients with RA may in fact be a marker of at least a short-term beneficial effect on the expression of this ongoing inflammatory disease. In contrast, trait PA was not associated with circulating levels of IL-6 in healthy older women, Riff et al., 2004. Positive Effect and Health 953. This document is copyrighted by the American Psychological Association or one of its allied publishers. This article is intended solely for the personal use of the individual user and is not to be disseminated broadly. Table 8. Summary of positive effect, PA, and immune function study participants. Design and independent PA measures, state, trait, manipulation checks, control sessions. Dependent measures. Relevant findings. Burke et al., 2001. 52 healthy men, mean age 27. Mood induction. Humorous film stimulus, state, none. NK activity, IgA, G, N, T cells, B cells, IFN gamma. Leukocyte populations from 10 minutes pre-stimulus, up to 12-hour post. Humorous video was associated with increases in NK cell activity, IgG, activated T cells, cytotoxic T cells, NK numbers, B cells, helper, and not committed T cells, helper, suppressor T ratio, marginal, IFN gamma and total leukocytes, as well as lymphocytes and granulocytes. Dillon et al. 1985, 10 students, mean age 22.9. Mood induction, humorous film stimulus, state. Rated funniness, control session SGA. SGA was greater after humorous video versus control and baseline. P. Evans et al. 1993, 12 undergraduates, age 20. Longitudinal, 2 weeks ambulatory monitoring, Nowley's mood adjective checklist items, playful, elated, energetic, kindly, leisurely, concentrating, state, not applicable SIGA. Within subject analysis showed higher SIGA levels on days with negative mood. Butterman et al. 1992, 5 actors, ages 25 to 38. Mood induction, improvisational monologues drawing on personal experiences, happy, depressed, anxious, state. Manipulation checks, control, neutral, session. NK cell activity, CD56 NK cells, CD57 large granular lymphocytes, T cells, total, helper, cytotoxic. There was more immune fluctuation combined for effect inductions versus neutral condition and more fluctuation in aroused conditions, happy, anxious, than unaroused condition, depression, neutral, descriptive data due to small sample size. Butterman et al. 1994. 14 male actors, mean age 35. 5 separate mood inductions on separate days, induced high arousal PA, euphoric happiness, and low arousal PA, relaxed happiness, by reading scenarios and using personal memories, also for high/low arousal NA, state. Manipulation check, no neutral control. NK cell cytotoxicity, lymphocyte proliferation to PCHA, number of NK cells, large granular lymphocytes and T cells, helper/inducer and suppressor. All mood states were associated with NK cell percentage and activity. Response to PCHA mitogen increased after positive moods and decreased after negative moods. Harrison et al. 2000. 30 undergraduates, mean age 21. Mood induction, humor, and excitement-inducing films, state. Manipulation check, control session. SJ at 2-minute post each film. No association between condition and SGA. Huckelbridge et al. 2000. 19 female undergraduates, mean age 19.7, and 41 male and female undergraduates, mean age 19.9. Study 1, mood induction, 40-minute session on 2 different days, self-reflected, very happy versus guilty, life experience. Study 2, happy music versus sad music, state. Manipulation check for self-reflection, but not for music. Previously validated. Number 1 baseline SGA, 10 minutes, post-recall, and 30 minutes post-test. Number 2 BL and 30 minutes, after music, no control. SGA increased with both manipulations regardless of valence, but there was a trend for a more pronounced elevation to occur only in happy mood. Separate analyses showed only a happy effect for the self-reflection experiment. Nuff et al. 1992, 20 members of the campus community, ages 18 to 30. 2 2.5-hour mood induction sessions on different days and 1 training day. Induction with recall of positive personal event and event reenactment. Also negative event. State. Manipulation check, no control. Lymphocyte proliferation in response to PCHA, CONA, and PWM, NK cell activity, T cell subsets. PCHA-stimulated proliferation decreased for both PA and NA inductions. CONA decreased with NA only. Labat et al., 1990, 39 women, mean age 21.6. Mood induction with a humorous and sad videotape, 28 minutes each, state. Manipulation check, neutral control condition SGA. Humorous stimuli were associated with improved immunity, higher SGA, 954 Pressman and Cohen. This document is copyrighted by the American Psychological Association or one of its allied publishers. This article is intended solely for the personal use of the individual user and is not to be disseminated broadly. Table 8 continued. Study. Participants. Design and independent PA measures. State. Trait. Manipulation checks. Control sessions. Dependent measures. Relevant findings. Lambert and Lambert, 1995. 39 fifth grade students. Mood induction. Humorous program. No manipulation check. Non-humorous presentation SIGA. SGA increased in the humorous group, but not in the non-humorous group. Logan et al., 1998. 10 healthy subjects with a history of herpes labialis, cold sores, ages 20 to 40. Longitudinal, 3 months. Daily report with bipolar scales. Content. Discontent, depressive, happy, unhappy and hopeful, hopeless, secure, insecure, calm score, anxious, relaxed uptight, calm, hateful, loving. Also affect intensity measure, trait. Not applicable. Blood drawn once per week for T lymphocytes and NK cells. Content. Discontent correlated with elevated NK cells, more content. The week prior to cold sore outbreak and higher CD8, the depressed composite, low happy, hopeful, was associated with lower CD8. Marsland et al., in press. 84 healthy graduate students, mean age 24. Vaccination study. PA measured after first 2 inoculations but before third, assessed with lively, full of pep, energetic, happy, pleased, cheerful, at ease, calm, and relaxed. Trait. Not applicable. Antibody response to hepatitis B vaccination. Trait PA was associated Several studies have examined whether PA reduces allergic reaction, both size and type 1 hypersensitivity, in response to allergen or histamine exposure in allergic participants. A reduction in allergic response was found when pleasantness and relaxation were induced by hypnosis, Laidlaw, Booth, and Large, 1996, and when humor was induced by a movie, Kimata, 2001. However, Zachariah, Jorgensen, Ejekvist, and During, 2001, failed to find an influence of hypnotically induced happiness, nor anger and sadness, on allergic response as assessed by wheel size. In a correlational study, Laidlaw, Booth, and Large, 1994, found that those reporting more liveliness, bipolar liveliness, listless factor, and vigor from POMS had smaller allergy responses. They also found that greater liveliness and vigor were associated with lesser responses to higher concentrations of the allergen. Feelings of peacefulness assessed at baseline on a BIPO. LAR peaceful, irritable scale were related to less skin reactivity in the Laidlaw et al. 1996 study described earlier. In some, PA inductions in the laboratory were generally associated with acute quantitative and qualitative changes in immune response. The implications of most of these changes for health are not clear. However, the ability to produce these responses is seen as adaptive. Induced PA was, however, associated with a more interpretable immune outcome, a lesser allergic skin response. There is also evidence from field studies that both trait and state PA are associated with elevated SIGA levels, although there are only a smattering of studies of the association of PA and other immune outcomes in naturalistic environments. How could PA influence health? The studies we have reviewed have generally been atheoretical in approach. Their reasons for using specific measures or using state or trade effect measures were unspecified, and the possible mechanisms through which PA would get under the skin were generally unstipulated and untested. To help provide a framework for understanding this literature and for planning future studies, we propose two models representing plausible pathways linking PA to health outcomes. The mechanisms we propose are meant to be